Let's get ready to surgically rumble. Hi everyone, I'm Matt Young, the Anchorman, and I'm looking forward to sharing with you ideas about improved cataract workflow this evening. These are real ideas, just to let you know, unlike this fake mustache. Anyway, joining me are three esteemed ophthalmologists this evening. Dr. Florian Kretz is in Germany, Dr. Harvey Uy is in the Philippines, and Dr. Matthew Russell is in Australia. Well, gentlemen, let's get right into it. I'd like to start off by asking, has the Zeiss cataract workflow improved efficiency at your clinics? And if so, if you could describe how, that would be great. Dr. Russell, let's start off with you, and then we'll go around the virtual room.
Yeah, it certainly has had a big impact. It's that and the reliability, the safety factor, the lack of transcription errors, but efficiency has been huge. We're working on a study with Zeiss looking at the impact of that, and we've almost completed the study. We've got about a 50% time saving from both doctor and support staff from using the system over the last couple of years compared to our traditional workflow. So most definitely, it's certainly much more efficient. The number of issues we've had related to transcription errors and orders or so forth has also been a huge benefit.
And if I could just follow up on that briefly, you mentioned the time element. Nowadays, how important is that time element in terms of savings when it comes to surgery?
It's a big issue for us. I mean, it's number one, particularly at the moment, it's very difficult to find qualified staff. We have almost no interstate migration at all at the moment in our country. And staff are expensive. We're a very highly paid labour force in Australia. If they are taken away from the clinical workflows, the supporting workflows, spend time on these tasks, then we're detrimental to the clinic in terms of having the support we need to function, and it's very difficult to find extra staff. And then also, of course, there's the expense of that, which is not insignificant over time. Two big factors, efficiency, reduced time. Another big factor is I know that when I select the lens, that's going to be the lens that's going to appear in Callisto on the microscope, and then all of the processes involved to order and select the lens, and then view that in the theater markedly more efficient.
That's great. And Dr. Uy, I think I heard a tuk-tuk or a motorbike speaking up on your behalf over there in the Philippines, but over to you. How about this workplace efficiency?
Well, we've been using it for several months now, and it's an amazing system. It's very intuitive, so our staff learn to use it very easily. And what we like the most about it is it greatly increases our efficiency. So we're now able to import data from our capture devices like the Iol Master and use it to plan our surgeries, and then send the game plan to the operating room, where the nurse just has to activate the system and guide us to perform the most precise surgery possible.
Fantastic. Well, Dr. Kretz, I think you're up next, and we certainly welcome you to the program with that wonderful sweatshirt on as well.
Thank you very much. Actually, the sweatshirt is standing for me for the connectivity of all those devices. We have been early adopters, so I started in 2015 using the Callisto with the Iol Master. And in the beginning, it's quite difficult to always transport a USB stick and have the right data on the USB stick, and then the technician forgets to upload a patient on there and you have to transfer it. So a big step for us really was when we started to use Forum and EQ Workplace to connect all our IOL masters in different locations, because I'm working in 3 surgical facilities that are the furthest away is 550 kilometers. And with having this workflow now, I have the capability to control each IOL calculation from any of our outposts or surgical units. We have specialized optometrists, and that's where I have to agree with Matt's staff, it's expensive. So we now have a limited amount of very well-educated staff, and they do all IOL calculations for premium lenses, toric, multifocals, and the doctors just double-check before the lenses are ordered. And that all has become possible by using that workflow and the EQ Workplace. for me is like a really great thing are the new apps coming out now, where you really can start with the onboarding of the patients, where you really can start with training our fellows, our younger surgeons, evaluate the videos, and you can really see that progress from 2015 to now 2021 with the workflow optimization. And I can fully agree, we use less staff, we use less time, we have less transcription errors, and that really is a great benefit for any practice, especially like bigger practices that have multiple facilities.
Well, it sounds like remote monitoring is becoming quite a hot topic in our industry as well. So it sounds like this helps to facilitate that.
Definitely. And it helps with the connectivity. I remember the times when I started surgery and had an IOL Master printout in the OR. And then for sure you have a posterior capsular rupture, but nobody printed out the one for a 3-piece lens. And then you have to calculate it in your head, or you have to like send somebody back to the IOL Master to print out another one. That was time consuming, and also patients become nervous during surgery if any of those events happen. Now that's something done in a couple seconds. The patients don't even realize if you switch the lens or you change something. Just that on itself makes the surgery and especially the complication management even safer.
Okay, well, great to know. And I've got another question here for the floor, and that is, how challenging has it been for you all to integrate the Zeiss Cataract workflow into your processes? And have you found any surprises along the way?
Yeah, look, it's been really easy. I mean, it's much easier we have, for example, our setup is we have a multi-lane clinic. We have 3 locations again, and we operate in 3 different surgical sites, fortunately all in the same city. But we're completely digitized practice, and we were digitized before this came along. And this actually has been something that's supplemented our previous workflow. And it's much easier now to turn to a computer, order the lens than it is, or to change the lens, than it is to go back to the IOL Master and print out another printout of the lens that you wanted to have in this particular case for some reason. So it's completely more efficient. All the lenses that we use are in the system, and it really is a matter of one click to choose the lens, the lens type, and one click to choose the particular lens that we're interested in. Very efficient. We were early adopters of the system as well. We were involved in the pilot release. The fundamental platform is really easy to use. We had some glitches, but were really just software glitches that have really been all ironed out of the system. It's a really fully functional, kind of seamless system at the moment. So short answer is no, it was straightforward. Our staff, relatively young staff, find this quite natural. They do everything on apps or on the web. So in fact, it was unnatural to be using paper to these steps. So really easy.
Fascinating. Well, Dr. Uy, over in your neck of the woods, how about you, and how about the integration of this system?
Yeah, so we had a very easy time to integrate it into our practice. And, just like with any software, you have to do a little customization. At the start, we had to program in our IOLs, usually our default surgical settings, like where you're going to put your incision, where you're going to do your SIA, plug in your SIA. And once you put in your favorite IOLs and all of this, then as you go through the planning, since a lot of the fields are already pre-populated, it becomes very easy to just import data from the IOL Master to plan out the surgery. We also had to do a little retraining. As Florian mentioned, initially we had to use USB sticks, but then after we linked up all of our systems, doing wired connections between our IOL Master, our Forum, our Callisto, this actually smoothened the way for us to utilize the system, and our staff is very appreciative of this. And just to mention also earlier, it has greatly enhanced our productivity. So right now, I'm in the car in this meeting, but if somebody called me up right now and asked me a clarification about the IOL, I could actually use my computer and access the EQ Workplace and figure out the answer or do some calculations while in my car. Really a great impact on our productivity.
Well, that's fantastic. And I assume, Dr. Kretz, the more efficient things are, the more time you have to pick out Christmas wardrobes. Am I right?
Oh, definitely. So we even have a bad sweater day this year. No, I do have to say, when you think about integration, I think it's the part where you're coming from. We integrated Forum very early, so we have all the OCTs connected, all the Clarises connected, we have other devices connected. All our images from photo cameras, even for lid surgery, goes into our Forum network. In there, we have this EQ workplace, which is the heart of the cataract workflow now. And I fully agree with Harvey. It's great when you are wherever want to be in the world, and you can check your IOL calculation. You can look at the central topography images that even include the total corneal power. You can rule out a keratoconus, and you can really see if the IOL selected match. And the best thing is you can't just control it, you can also change the calculation or open new calculation to basically change your whole planning. Wherever you are, you can already transfer it to your Callisto system for the surgery itself, so everything is planned. That's not just the efficiency in the practice that you have less steps with your staff, that's also your own efficiency that increases. In the past, I often came in the morning and then you have like 20, 30 files lying there to check over. Now I can do it in between my patients when I'm waiting, because I see the patient popping up, I go in his file, I control it, and it's done. So actually, I have become much more time efficient.
I remember speaking with Zeiss executives in the past, and sometimes they would refer to units being siloed, and I think there really has been a lot of outreach in order to make things more streamlined between different systems. So that sounds like what it's going out on here, integration for a fully streamlined process. Would you say, Dr. Kretz?
Oh, definitely. I do know that there is EQ is also available in a cloud version now, and I think that's what they're going to start more and more. We have it all based on our servers, which are also standing 800 kilometers away, and we just have all facilities connected over different internet lines to them. We even use satellite internet in some facilities now as backup lines just for Forum. Once the setting up plan is a little bit time consuming, you need to sit down with your own IT together with Zeiss, and you need to plan it. But once you have planned it well, then you really find a very good solution. Personally, I have not seen any other system that has a similar efficiency. We did try the software from Heidelberg Engineering for the Anterion and stuff, but it's just not that intuitive yet that it could compete in any way with Forum and EQ Workplace.
The difference is this is a platform. This is like and it's a complete digital transformation of a whole series of different workflows that are done within the practice. Like we look at the number of steps that are involved in selecting a lens and then having that information dispersed to all the relevant parties, the day surgery, the lens vendor, and so forth. There are multiple sub-steps. Well, this is a platform that allows all the interested parties and will increasingly allow all the interested parties to be able to get all those processes done, pretty much with a lot of them done in the background and really efficiently, minimizing the human input. And it takes a lot of variability out of it. And it's a little bit like catching an Uber. It's like it connects all the parties together. The machinery, the car, for example, or the Iol Master, the microscope, connects all of those things and connects all the humans in one platform. Whereas you look at other vendors, what they have is some software connected to their hardware, and that's a completely different approach. That is an approach that was where Zeiss was several years ago. There's no one else really doing this.
I think what you just said, Matthew, was the hardware connectivity. That is really something that is special, because you're not just importing data and making calculations, you're also exporting it. I really have to say also for my staff nurses that are really busy in the OR, it's so much easier when they already have everything on the Callisto screen. We work a lot also with incision locations, opposite clear cornea incisions, arcuate incisions, and toric lenses. So it's so handy for them that they have all the data available. And we did just test the Quatera system, what made it even easier, because now the scrub nurse actually can see on the screen herself what I'm seeing in the microscope and what the helping nurse in the OR is working with on the Callisto. And I think that integration step is even further ahead than anyone else is at the moment.
Fantastic. Well, on to the next question of the evening. How have patients responded to the Zeiss cataract workflow, and how effective have treatments been compared to previous methods you have used? And Dr. Russell, if we can go back to you on that one, that would be great.
Yeah, I think from a patient's point of view, it really demonstrates to them that you're at the leading edge of the game. I mean, this is that they can see on the screen all the variables. When I start to explain how we choose the lens, not in great detail, but so it's very different to choosing a spectacle lens, and it's based on these calculations and all the measurements we've obtained, very sophisticated, precise measurements. And we're going to choose, based on our discussion, we're going to choose the implant right now, and that's, and I'm going to get a heads-up display and almost augmented reality when I'm treating your astigmatism through the microscope. Okay, and so I think for patients, it's almost mind-bending. They find it mind-bending that we can treat astigmatism and the refractive error at the same time. When they see how it's done now, they're impressed. And I think it just makes for, the next thing is just having that patient go from the Iol Master into your room, and all the data is right there, with no pieces of paper, with nothing like that. It just makes for a very, very smooth transition of the patient through the clinic. So a good patient experience, that's just going to be enhanced as the platform grows with the patient apps and also the next generation of the software. This is really just the beginning of this digitization process.
And how about for you, Dr. Kretz? How do your patients feel about it?
Oh, I think we can even start a little bit earlier. We have been testing the new Zeiss apps now for the onboarding. So we are really able to give those patients the informations now beforehand. And we did test other apps also together with Zeiss to see what are patients interested in, what type of data. The main things that the patients were interested in were all our forms that they have to fill out on the day that they come in, the anesthesiologist, the anesthesia, and the implants, but also basically like the patient journey, which steps is a patient running through until he's done with the surgery. And here this onboarding process over the app is really a great benefit that brings the patient in this cataract workflow when he enters the clinic. Because now we have more educated patients, and actually it's not the patient that gets educated because they are old. We are educating now their family that brings them in, that has to explain the forms, the procedures to them back at home. And you can really see that we have an increased number of premium IOLs. Right now, since we started working with the app, it's roughly around 6% that it went up just with introducing the apps, putting all the forms and the stuff on there. And if you look at the download rate, it's 80% downloaded by the ancestors of the family of our patient, not by the patients themselves. They understand what's going to happen. And in the past, we often had the problem that somebody calls and says, oh, you sold something to my parents. That problem has disappeared because they have that information beforehand. They can look at it, and we don't have this after process anymore where we have to explain it a second time to a person that wasn't there at the first examination visit. I really think that even if it's not fully integrated in the cataract workflow, this onboarding process is going to become an even bigger part of the future, especially when we also look into more refractive procedures.
Excellent. Well, I believe Dr. Uy is settled in back home. Over to him for a moment. Dr. Uy, are you here and able to answer a question about how this is affecting patients?
Yes. So I think the greatest impact for our patients is actually something they don't visualize during their visit. So when the patient comes to the clinic, they may not be aware of all the that go on, but they're certainly aware when they, after the surgery, come in with 20/20 vision. So because the system allows us to do better IOL planning, do better, more accurate incisions for correcting astigmatism during the surgery, align that toric IOL better, we get better refractive outcomes, and patients appreciate that the most. They may not see everything that goes behind the screen, but they get that great outcome. Secondly, sometimes when we're doing the planning, we would actually identify some red flags using the EQ workplace. For example, we would see somebody who's maybe their Chang cord is too long, and it identifies some red flags, and we would call up the patients and come in and talk to them more about the lens that they're planning. Maybe it's not the best for them. And actually, patients appreciate this cautiousness and safety that you put into your practice. And we find that the EQ workplace helps us greatly to be very safe and be very accurate in our IOL planning.
Well, by the way, speaking of efficiency, you've efficiently turned night into day, and you've managed to turn that highway into ending in a beautiful water area, Harvey. So congratulations on that. It looks lovely.
Well, I'm inviting all of you to come here to the Philippines, and let's go to the beach.
All right, open invite. Well, gentlemen, back to a question for the floor. Now, the Zeiss Cataract workflow really has four main components. Zeiss calls it assess and education, plan, treat, and check. And I just wanted to run through that with you all because, when we're talking about workflow, this is still a little bit abstract. So would you say that this is a good way to describe really what's happening during the workflow? Back to you, Dr. Russell.
It's a nice way of breaking it down. And I think, we're really looking forward to experiencing what Florian's, obviously working with Zeiss with and being on the forefront of that with the patient apps and so forth and that education and engagement process. I think that's a really going to open up a lot of opportunity for specifically educating the patient, being able to engage them early, get them understanding the process, be well informed before they come in, understand the choices available to them and match them appropriately with the right refractive solution. And then probably be able to interact with that information later, take that away from the consultation and not, a lot of it goes missing when it's just a verbal interaction. So yeah, I think that's a great leap forward actually in the cataract surgery. We haven't actually used the app yet, so we look forward to that.
Dr. Kretz, would you also describe the program in this way? Or do you have another way that you might describe it for our audience?
No, I think the description fits. But it sounds a little bit like it's like step following step. You evaluate, you educate. It's not really like that. All those steps are kind of there at the same time. Because you always have the evaluation of the patient. You always have the training part in it. Because you get so much data presented in such an easy way, and you're also able to change that data. Like you can manually input other K values or different axial lengths or different lens thickness in the EQ workplace. You can record your videos. You can later screen the videos. You can let those videos run through an AI and it evaluates it for you and also compares it or shows a video of an experienced surgeon beside it. You can optimize your A constants later on once you have evaluated your patients. It's for me, it's not like a circle that is going around with the whole workflow. For me, it's like an enclosed system itself where you have all those perspectives at the same time and you can just pick out what you need at that moment. I don't know if my description really makes sense, but it's not this like step after step after step what we used to. It's more because you can always go back a step and you can have a different aspect of it.
I imagine, if I'm not wrong, I imagine that the patient app is going to be something that will allow this thing to not be linear. You don't have to be in sequence all the time. You're going to get some information at the beginning. There's that part of it, but I imagine the patient can go back and educate his or herself at different points along the whole journey. There's going to be different opportunities, different touch points, different interactions, educational interactions happening not just at one point but all the way along.
And the educational part is not only on the patient side anymore. You have your whole staff educated about new implants, about new A constants. I'm quite young, but I have younger fellows working with me, and I need to train them. With all those video analyzers and having the possibility to look at their own surgical work, compare it to mine, but also compare it to other surgeons in the world. That is like a great way for them to be educated surgically and see those patients' outcomes and enter their own patients' outcomes and maybe even see if their A contents vary a little bit from my A constants, if they have a different surgical induced astigmatism. That really is like a great benefit also in the education part. And it just saves time overall, not just the counseling time, also the time for the training.
Well, I believe you have some experience too with the iGuide app, Dr. Kretz, if I'm not mistaken. Could you explore that or let us know a little bit more about how that works?
The iGuide app is the patient education app. And it's based on a general platform, and each clinic, each facility can enter their own data. So basically, the patient downloads the app, and then the patient decides which clinic he's a patient of. And then you have your customized information that is basically on this clinic part, and you have the general information, where you do have to say it's very product neutral. So really the patient get a neutral explanation of the surgery of implants. And then there's the customized part that is programmed by each facility on the back end, where you can introduce your doctors, where you can upload your personal forms that the patients can download and fill out, where the patient has a direct contact button to your clinic. It makes the communication with the patient much easier. For example, we try to bring our patients away of calling our phone central because you'd never get through. There's just too many people calling. But email or messaging is so much easier, and it's something that you can just answer in between 3 minutes later, and the patient is not having to wait in a phone line. And the whole app is really a great benefit in also making this communication with the patient better and educating the patients to become more digital instead of being analog on the phone.
Over to Dr. Uy. Dr. Uy, would you also describe the workflow as, again, being similar to these four methods: assess and education, plan, treat, and check? Or do you have anything else to add in this regard?
I think it's a very good educational tool. I teach at the university. Very often would show our videos to the residents, and they appreciate the precision of the surgery, and we can take them through the steps in doing IOL planning. And I think this is a very important part of getting good outcomes. I think cataract surgery, we would all agree, 90% of it is actually based in the planning, and maybe 10% is in the execution of the surgery. So with the EQ workplace, it elevates the level of IOL planning to a high level of precision. And when we show how we do the planning with our trainees, they really appreciate all the effort that goes in, and they pay more attention to the details from the patient data.
By the way, part of the treat component of this system includes the Quatera 700, which I understand launched in the autumn of 2021. Dr. Kretz, could you explain a little bit about that device?
I did speak about it a little bit before. The Quatera system is a new quattro pump phaco device from Zeiss. And the great benefit is all those phaco devices are big, but the Quatera is the only one where the screen actually also shows the surgical video and shows all the data that is entered in the Callisto system. We all want to confirm what we are doing. So we have the data in the Callisto, but you as a surgeon are sitting on the microscope. So in some ways to review it, you need to look on a laptop or something. Now it's very handy because I can review it with my scrub nurse that is sterile on the Quatera system, while the nurse basically just presses the confirm button on the Callisto. For this whole confirmation patient safety aspect, I think a great step in the right direction, especially as we are doing more and more corrections for astigmatism. The other thing is that it's a brand new phaco device. The pump system is amazing, and you can work with a vacuum of 700, and with the 4 pumps you always have a stable chamber, and because of the sensors in each pump, it really keeps the pressure absolutely stable. So you work with less than 40 millimeters mercury of pressure, and you have no leakage, you have no collapsing of the anterior chamber. Because you have a high vacuum, with the right technique, I was able to do 2+ cataracts without the use of any phaco. And just basically breaking them on the tip and sucking them away with the 21 gauge phaco tip and the high vacuum. Your surgeries become faster, you have better anterior chamber, the stability is great, but I think for me the main aspect really is the increased patient safety for the checkups before the surgery, because you can get everything displayed on that monitor. In theory, you could even play a movie on there. So it's really completely connectable to your devices and just makes it more handy, and you don't have somebody standing there. You need to again look at the chart. Does all those values fit before you start the surgery? And if you reduce the time from your timeouts to check for the patient, that really increases efficiency in the OR as well.
I should note here that both the Quatera and iGuide are not yet available in the APAC and some European countries as far as regions go. So if our audience can note that, not yet available in some regions, but I'm sure coming soon at some point. Moving along, I do also wonder about, again, each of these components of the cataract workflow. So if we're looking first at the assess and educating portion of that, there is the Zeiss Iol Master. Would anybody like to comment on the Zeiss Iol Master 700, just in the integration into this system? And I know there have been some comments already, but I'd just like to explore this a little bit further. Starting with you, Dr. Russell.
Well, I think, as a surgeon, you really don't need to have any kind of interaction with the Iol Master 700. You know, if your staff are taking the scans, you've got a great technical support team. Your interactions with that device are really just going to be through EQ Workplace. It's great. All of the information you need is in EQ Workplace. So you have the printouts if you want them in PDF form, and certainly, we review those, and then almost all of the pertinent information is in the interface, the user interface for EQ Workplace. So everything you need as a surgeon is in the platform.
Dr. Uy, over to you. Any thoughts about the IOL Master 700 in this situation?
We found that the IOL Master 700 has been a game changer in our practice. Before the IOL Master 700, patients for cataract surgery would have to go through a series of different machines to measure their cornea, to do the biometry, and then even to check the retina. Now, the IOL Master integrates many of these functions together into one unit. So we're now able to get a very good measurement of the corneal curvature, for example. We can do the keratometry and measure both the front and back cornea. And then on the other end, we're even able to image the foveal area, and this will help us red flag patients who might have retinal issues and which might prevent them from getting premium lenses. And then one of the most amazing things we see about the IOL Master, in this part of the world, we probably have some of the densest cataracts you can imagine. And before, with our older biometers, we wouldn't be able to do optical biometry. But with the IOL Master 700, we can image through anything but the most dense cataracts and get very accurate measurements of the axial length. So putting all of these together, we're able to rely on the IOL Master for doing almost all of our measurements for cataract surgery and make the measurement process more efficient for both the practice and the patients.
Dr. Kretz, I'll let you have the final word on this subject, the IOL Master 700.
I think the comment is very dependent on the perspective. With Russell as a surgeon, I fully agree. I have nothing to do with the IOL Master 700 anymore. My staff does it all. It works perfectly fine. They're happy. As an investor or owner, I have to say it reduced my costs because I have one machine, like Harvey said, that does the biometry, that gives me a screening for the fovea, and that now even gives me a corneal tomography with the central mapping. So in one machine, I can straight away, I have all the data I need for my IOL calculations. From talking to my staff, I do know that they're very happy in using the machinery because the data can be uploaded very easily. You have your full workflow basically started on there to start the IOL calculations. And with that, it's much easier. And we have tested many biometers. We also have other biometers in other facilities. So far, the IOL Master 700 is the one where we get the most precise measurements, the best repeatability in the measurements, and we have the easiest transfers into our systems for further evaluations and surgical planning.
I agree with that. With our premium lenses, we have multiple biometers. We have Heidelberg system and so forth. It's rare for us to actually use any data from it because the IOL Master is so accurate and so dependable. But more importantly, the data is absolutely easily utilizable. At the click of a button. For the surgeon, it really is probably 1 or 2 clicks in terms of selecting the lens, and then another 1 or 2 to order those lenses. We're using the system to do all our ordering. We've liaised with all our IOL vendors, and we simply from the system send an email directly out of EQ Workplace to the vendor to order the intraocular lens. So we know there's going to be no errors. It's super efficient. It's done. Every lens calc is done immediately following the consultation. So we do everything in real time. There's no work in progress. That aspect of is one both very, very efficient, but it's also, there's no possibility of error. Huge comfort as a surgeon.
Well, that Zeiss EQ Workplace is part of the planning portion of the cataract workflow, as is the digital ordering component. Usually we don't talk about digital ordering in clinical discussions, but I am curious about it here because as we know, we've all roamed around the planet going to conferences and exhibitions worldwide. Lots of times there are distributors or, the manufacturer that we might purchase from, but this online ordering thing, is this really going to be part of the future now? And does it make things a lot easier to get things into the workflow?
Most of our orders are done online now. It's a system that you have to customize. We used to have a central ordering where we also ordered the IOL centrally. We did switch that. For the premium lenses are the only products that are ordered by our team of optometrists to do the calculations. There is a copy of the order sent to our billing department, so they already know what's ordered. Then the product gets delivered and they get the paperwork of the delivery, so they know that what was ordered was delivered. They'll know the price that is behind it. And when we get the bill to basically pay the vendor, then they can double check. So I don't have any more nurses or other staff in this process of checking what did we order, did it arrive, and how much did it cost. And that makes it more effective. But it's a process that you have to customize. So all we did, we have 2 emails going out from EQ Workplace. One email goes directly for the order to the vendor. The other one goes into our booking department so they know an order has been placed.
I mean, I see the future because I think this is a clinical issue, because a very, very concerning issue is implantation of the wrong intraocular lens, right? The more times you can eliminate transcription, the more times you can eliminate transferring data from one system to another using a human, the better, the less likely it is we're going to have an error. I mean, you're set up for an error if the wrong lens turns up in the first place. We hope we have all the checks in place that will stop that from happening, but we know that, systems can break down. I think it's a clinical issue that we avoid as much as we can transcription problems. So we have that piece of paper, like Florian says, it doesn't just go, not that piece of paper, but that the data in that email is going to our operating room, admin, to the vendors. Everybody's getting the same information. So it minimizes the risk that we're going to have that never event of implantation of the wrong intraocular lens. You can explain PC rupture. Some cataracts are high risk. They happen from time to time for every surgeon, but it is very, very difficult to explain the implantation of the wrong prosthesis.
And Dr. Uy, how does digital ordering work over there in the Philippines?
First, I'd like to point out that we're very fortunate now to be in a golden age of intraocular lenses. There are now so many new and advanced IOLs in the market that surgeons have the luxury of customizing the lens we're going to implant to the patient. Unfortunately, this creates a need for having a lot of inventory. For practices like ours, we're not able to have a big inventory of lenses. But by having this digital ordering system, we're able to quickly figure out what lenses we need for a particular patient. The EQ Workplace allows you to do a plan A, plan B, plan C, and then you can order these lenses individually. And as Florian mentioned, it's very important to customize it to your practice needs. So in our practice, the IOL that we need is digitally sent as part of the planning process to the surgical coordinator. A copy is also sent to the operating room. And if we have the IOL in our inventory, then the nurse in the operating room will confirm to the surgical coordinator that we have this lens already available. But if we don't, then the nurse will send it to the to the surgical coordinator, who will then contact the supplier and make sure that the lenses are there with a lot of time allowance so that we can be prepared for the date of the surgery. And certainly, as Florian said, you can also send a copy to your accounting so that we have less issues with the accounting for these lenses.
Well, Dr. Uy, you've brought us to the treat part of the workflow. So indeed, this has several different components, including the Zeiss CT Lucia, the Zeiss OptiKit, Zeiss OVDs, the Quatera 700, and the Optilumera family. And so I'm curious, because we're talking about workflow here, of course, the treatment part is quite important. So are you all happy with the treatment component of this system? Over to you, Dr. Russell.
Yeah, look, I very, very much so. And look, we look forward to getting, some experience with the Quatera and other components of the whole platform. Yeah, I think it's a really nice integrated, ecosystem, if you like, of both software and hardware and prostheses. I'm not sure how much we can talk about here, but there's some very exciting things that are, I think, in the pipeline as far as having even more sophisticated approaches to lens selection in the platform, and then that can integrate into the lens selection and having a very seamless way of ordering and delivery of the implants.
Fascinating. Well, Dr. Kretz, you're a little closer, or in fact in Germany. How do you see the contemporary treatment elements here versus maybe things that are coming in the future?
The benefit with working with Zeiss is that for any field in your surgical workflow, there is some tool available. And I did test the Quatera, and we did test it extensively. And it's a great phaco machine, and it's not just the phaco itself, like I said before. I think this like whole surrounding, the timeouts, that's also what makes it special, because it gives more patient safety and it gives more efficiency. I don't think there is much to talk about that the Lumera system is a great microscope system. Same like the Atevo now. So, but with connecting those devices, I think that is what really makes this little difference, especially by having the possibility to connect them over your own clinical network. We haven't spoken about it yet, but many other devices that have connectivity, they do work over their own Wi-Fi, or they have to have a separate network. With us, all our Zeiss instruments are completely included in our clinical network. And we are working on connectivities to our EMR systems right now to transfer more data from the EMR onto those machines into Forum, and also to getting data like outcomes or IOL selections or surgical videos back into our EMR system. And I think that is what makes a really like great difference. And I do believe that there is much more to come. Like with the Surgical Optimizer app, for example, you can upload your Callisto videos directly. You can screen them, you can cut them. It's a very easy, handy way for any surgeon to basically start working with their own videos, building their own library, and being able to compare their own library, their own cases to other, or just to look for, let's say, complicated cases from others to learn. Like I said before, I don't like this step-by-step approach that is sometimes shown, where the treat is its own pass. For me, all passes are always there at the same time. And I think that is what really like makes the difference, that it doesn't all build up on itself, that for each machine, for each software, you have all the capabilities in it already. I do have to say there's nothing more that I would change on the treatment itself, but I do know there is going to be much more automatism on there, making it easier, making it more safe, more secure, and also making IOL selection more automated and easier for us as surgeons and less time intensive for us and our staff.
Well, Dr. Kretz, you obviously, congratulations on being one of our Media Mice KOL influencers for 2022. And I'm curious whether some of the editing software here you mentioned might make it easier for educational purposes, also for even, I don't know exactly, but uploading to social media so that the whole world can become educated about the tactics you're using there in Germany. Is that possible here?
In theory, it's possible. But the question is, I'm not really a friend to show all my surgical videos to a patient, because the patient has no chance to see, is that good, is that bad, is that a complication? And the only thing that I hear from patients that look on YouTube videos is, oh, that looks gross, oh, I'm afraid. So personally, posting it on a social media platform for ophthalmic surgeons, great idea. I'm absolutely with you. But sharing the surgical part with patients, I prefer to use animations that can explain the patient in a simple step what is happening. Different with using that technology or showing the patients how the measurements work. So we do record with our videographers or with our photographers how we perform measurements, what is going to happen. And that belongs for me for this patient journey. And that is something that we are working on to implement in the eye guide, so the patients know what's happening. How does the examination look? Many patients still think it hurts to go to the doctor and it hurts to go to the ophthalmologist, just like going to the dentist. But actually, I would say out of measuring the IOP, we were completely no touch. So it does not hurt. And just that part is the security that some patients need to come in and to get their eyes treated.
Well, we've reached now the final part of the system, the check part of the system, and you all have already gone over the Zeiss Surgery Optimizer. There's also the SL800 and SL imaging solution. But all of these together, I suppose, checking things at the end after the treatment, this is still a very important part of the workflow, I presume. Would you like to say anything about that, Dr. Russell?
Yeah, sure, absolutely. I think probably, The optimization of A constants, very, very easy using the system. It really is. It is the easiest A constant optimization I have ever had the luxury of using during my career. That's a huge benefit in its own right. From 20 to 50 patients, just about a matter of putting the data back into the system and the A constants optimized for you. So really very simple. So that's been fantastic. Huge benefit to the system, and very easy to train our staff to do it. And really, it means that the level of expertise of the staff member who can be assigned to that is actually reduced, and we've taken full advantage of that.
Dr. Uy, are you using these checks at the end of the procedures in a more modern way than ever?
Yes, and I completely agree with Russell that this is the best way of optimizing our A constants. And I believe also the main benefit of having this EQ workplace and making it easy to input data from our machines is that we're actually going to be able to generate a lot of data that we can use for analysis. And in the future, I'm sure this data will be used to optimize our outcomes even more by fine-tuning not just our A constants, but also our surgically induced astigmatism. We may be able to use this data to figure out, to customize better the lenses to our patients, figure out which eyes will do better with relaxing incisions or toric IOLs. Also, we can use this data for maybe even doing inventory management in the future.
And Dr. Kretz, I'm going to let you have the final word on this topic. Over to you.
Well, I like the A constant optimization because it's very simple and very straightforward. But I do like the connectivity to IOL Con as well, so we can basically update our A constants automatically as well. Personally, I like and you spoke about slit lamp images before. I have 3 surgical facilities and we do 8,000 surgeries in total. Many of them are just intravitreal injections or that count as surgeries. But we also do more than 4,000 lens surgeries. I do 3,500 of them. So I have some young surgeons, but I can't be everywhere at the same time and I can't see all the patients. And I'm the only one that has to fix everything. So for me, it's very important that I can see a case digitally because I won't see the patient until the patient lies in front of me in the OR. And with having the possibility to document for them to plan the surgery and then just to show me this digital work plan for that patient, I can do that while I'm driving by train somewhere or while I fly somewhere, check my work plan with that patient. And it's really enough for me to see the patient lying in front of me in the OR bed without having to see them as an outpatient beforehand. And so having this possibility to check on my colleagues and giving them the opportunity to have me look over their cases, I think is another great aspect of the whole system.
Excellent commentary. Well, we're near the end of our roundtable this afternoon for you gentlemen. Thank you so much for joining. I do want to go for a couple Q&As before we conclude though. We do have one question from our audience tonight. It says here, for new surgeons who will use the cataract workflow, how steep is the learning curve? How long did any one of you take to become comfortable in actually using the system? Would anyone like to comment on that?
Well, I can comment. It takes a minute. It's a digital workflow. It takes a minute. Once they show you which button to press, then it's very simple. And most buttons are in the same way with an arrow showing that's the next step you have to go through. I have to say there is no real learning curve in the workflow. Once the setup is done completely. In the phase where not everything is programmed and customized, then it's a little bit more complicated because then you have to do some steps manually.
So it used to be a New York minute, now it's a German minute, just still 1 minute. That's great to know.
Yeah.
Anyone else?
I think it's very, very intuitive. It's very simple. If you use any app, if you can order an Uber, you can, as a surgeon, once the system is set up, you can use it in your clinic. It takes a very short period of time to select a lens. And in fact, we do that right at the end of the consultation or with the patient in the room. It can be done in real time, saves a lot of time after hours or before clinic, trying to organize or check lenses. So it's very straightforward.
Yeah, I think kudos to the Zeiss engineers for making such an intuitive system. We see little children take to the iPad with ease, and I think any surgeon would take to this system also very easily.
There's now two questions on the floor for Dr. Kretz. Firstly, what's your preferred method of communication with patients' families? Do you communicate directly or ask your staff to do it? Sorry, there's one third question. And where did you get that awesome sweater?
Okay. I personally like to communicate with my patients by email because it's a written form. I often have patients or ancestors of patients and they say, oh, that wasn't said. But I do know I did say it. So I much prefer to have it in a written way because then I can basically say, here, you have it black and white, that's it, that's the email I sent. And I can also attach the email to my EMR system. I can't do that with a telephone call. When I realize that patients are upset or they're very nervous or the family is very pushy, then I call them, but I always write a note afterwards to put it in the EMR system. And often I just explain it briefly and I tell them I will answer them by email. So they also have it in a written form in case they forget something, they can reread it. I try to educate all my patients if they have a difficulty, send an email. We have many people here, they're looking at their emails all day long, but the phone lines are busy. And I believe the more patients you get onto a digital pathway, the easier it becomes dealing with them. The sweater I got as a present from my daughter. I think she picked it with my son on Amazon.
Awesome. Great place to order. Well, do you gentlemen, before we wrap up, have any questions for each other after this illustrious evening?
No, I think it's been really interesting to hear, some of Florian's experiences. We look forward to exploring more of the platform, more of the ecosystem in time as these things sort of migrate across the globe. I think it's going to be a really exciting time. And I think that, having seen some sort of insights into what's ahead from the Zeiss team, this is just the beginning of a very different way of practicing medicine, digitizing a lot of the processes that are better done by a platform than they are by humans. So exciting times ahead.
I really thank Zeiss for the opportunity to be on this panel, and being with Matthew and Florian, I'm getting a better glimpse of what our future would be, and we should not be afraid of it. We should welcome that future.
Gentlemen, I actually want to just chime in here and say the comments are starting to really flow in now, or the questions, I should say. I'm going to summarize two in one. It says here, from Vicente Lorenzo Cabahag, are there any ideas or comments you think might improve the current system, or do you think it's fine as it is for now? And there was another anonymous attendee that had quite a similar question.
One of the challenges I think now is that we all have electronic medical record systems, and they're different from practice to practice. It would be fantastic if we could find a way to directly import data from the electronic medical record system into the EQ workplace to help us even better input data and do planning.
I 100% agree. I'm with you, Harvey. I think that's going to be really critical. Having that sort of interface and is important, and it's going to be interesting to see how Zeiss try and solve this problem going forward. But I think that they can probably set the benchmark for APIs and interfacing.
Well, I have to fully agree with you, Matt, and with you, Harvey. I think the APIs and the connectivity to the EMR system is the one thing that is really missing. But also setting up a joint standard for any ophthalmological device like they did in radiology now, where you can see the images, the data from every device and use it, would be a big step in the future. But it's never going to stand still, and there's always going to be something coming up that we don't have in our mind yet, because I think 5 years ago, nobody thought that we could ever live in the UR without the paperwork that we used to have there. And it all has changed. So I do believe there's a lot that can come in the near future to make our lives even easier.
Well, at the tail end here, I'm just going to ask our production team to see if we can put a link in the public chat to the Zeiss virtual showroom. That's an interesting place to visit to learn more about this system virtually. Feel free to click through. We're not at physical conferences anymore, so it's always interesting to click through and see virtual showroom when we're in dialogue. But in any event, that is a wrap for this webinar towards an improved cataract workflow. I'd like to thank you, gentlemen, for your great commentary today. And Don't forget, see you next time for the 4th and final edition of our Anchorman series. Until then, stay classy. Especially you, Dr. Kretz. Thanks, guys.
Thank you, Matt. See you again soon. Bye, Matt. Bye, Harvey.
Everyone.
Cheers.